Thank you, Dr. Matthew Fay, a GP from Bradford, Yorkshire, and trustee of the AF Association and also Arrhythmia Alliance medical advisor. Thank you for joining us to answer questions on atrial fibrillation.
Pleasure, Trudie.
Dr. Fay, we're in the middle of a pandemic, hopefully beginning to see light at the end of the tunnel, but AF patients are very concerned. Should they continue self-isolating? Obviously social distancing, what should they be doing during this pandemic?
A patient who has just got atrial fibrillation, so they're otherwise fit and well, and their only issue is atrial fibrillation, they don't really need to socially shield. So they should be maintaining social isolation as recommended by the government, but of course we're seeing that relaxed a little bit now, so we can go out as long as we're staying 2 meters apart from other people who don't live within our household. And of course it's important to get that exercise. Unfortunately, a lot of patients who suffer from atrial fibrillation also suffer from other cardiac problems and other respiratory problems. So we do see a lot of atrial fibrillation in people with heart failure and in people with COPD. Now, that combination of illnesses is not particularly good in a COVID situation. So you are more likely to need intensive support if you have other problems with the heart or other problems with the lungs, if you were to get COVID. So I would suggest that you continue to socially shield and maintain your distance from the rest of the population as much as possible at this time.
And if you have AF and high blood pressure, are you at greater risk or more vulnerable from COVID?
So we know that people with high blood pressure are at higher risk of issues with COVID. Not as bad as other cardiac conditions that I've just mentioned, but we know that poorly controlled hypertension seems to be a risk factor for people who get COVID and may end up on intensive care. So the major thing with your high blood pressure is to make sure it's well controlled. So try and maintain a blood pressure as close to normal, that top figure 130, close to normal as possible. But of course, if you have AF and hypertension, then you should also be on an anticoagulant. And interestingly, we know that people who suffer an episode of COVID who are anticoagulated seem to do better than those people who aren't. So it may be that the risk of the hypertension is somewhat lessened by the fact that you are on a long-term anticoagulant.
Now, a lot of AF patients have had their anticoagulant changed from warfarin to a DOAC because of cancelled clinics, unable to go to the INR clinics for blood tests. What words of reassurance can you offer? Because a lot of patients that have been tolerating warfarin for years are now finding they're on a new medication with no follow-up, no blood tests, and they're very concerned.
So warfarin's been an excellent medication and it has seen us through the last 60 years. It's a complex drug with multiple interactions and the need for very intense monitoring. We're now actually in a better world for the patient who requires an anticoagulant. We've got drugs that interact with a lot less, need a lot less testing, and although they may seem new, we've actually been using them in clinical practice for 15 years. So these aren't new medications to us doctors, although it may be a new medication to yourself. So what should we think about with these new drugs? We're not going to need our blood test monitoring. We're not going to need our INR because these drugs don't require that and are very effective and are known to work irrespective of what you may have eaten, how many green vegetables you may have had, how much alcohol you may have drunk over the weekend. So we know that these drugs don't require that monitoring. They will need a bit of surveillance. So you may find that the doctor wants to check your kidney function 2 or 3 times a year just to make sure you're on the correct dose. And you need to remember to take it. One of the things with warfarin and all that monitoring and the little yellow book in your pocket reminds you that this is a drug you have to take. The anticoagulants will only work if you're taking them. These drugs are short acting, so if you don't take them for a day, you're not anticoagulated that day. It's important for you to take them. Some people have been told that we don't have an antidote. well, we don't have antidotes for any medicines. We only have antidotes for poisons, and these are highly effective medications. And we have not had a reversal agent, something that will return the blood clotting to normal, until just recently. And now we have reversal agents available, and all hospitals have very comprehensive protocols on how to deal with people who are bleeding if they're on a DOAC or if they're on warfarin. Both of them need proper medical management, but there is no increased risk of bleeding on a DOAC compared to warfarin, because the hospitals know how to deal with both of them.
That is reassuring. One final question. If a patient contracts coronavirus, should they continue with AF medication and anticoagulants?
So most of us, when we get our episode of COVID, and most of us will get it, most of us will not know we've had it. So 1 in 2 people will have their episode of COVID and not know. If you are symptomatic and you'll have symptoms like a cold or maybe a nasty flu, then it's important that you continue with your medication, particularly those drugs that will keep the heart rate under control, because in any infection, our heart rate tends to run away with itself a little bit. And definitely if you're on an anticoagulant, because we know that those people who get COVID are slightly higher risk of getting clots. And because of your AF, and because you're on an anticoagulant, you're already protected from that situation. So absolutely important to keep on the medications as prescribed if you were to get COVID.
Thank you, Dr. Fay. As always, very straight talking, very easy for patients to understand and very reassuring. Thank you.
Thank you, Trudie.